Hi, today I'll be presenting about personality disorder. So, what is personality disorder? By definition, personality disorder is a persistent maladaptive behavior pattern which deviate from social and cultural expectation, and it has effects on the emotion, cognition, and behavior, and also impacts on the occupational, interpersonal, and social functioning. So, among the core features of personality disorder are emotional dysregulation, interpersonal difficulty, and behavioral inflexibility. So, getting to know about personality disorder is important in counseling practice because it is a long term and it is a deeply rooted pattern of behavior. And it is difficult to change in a short term counseling. And usually, client present to the clinic with indirect issue, meaning with presenting issue, which is secondary issue. So sometimes counselor might overlook about this personality disorder. So, by getting to know about personality disorder, then counselor can do a proper identification, proper guide intervention and management of the case. Okay, for my portfolio, I choose avoidant personality disorder for my first case. So, AVPD is cluster C personality disorder, which is characterized by fearful and anxious characteristic. Usually, individual with AVPD, they will have interpersonal pattern, like they has desire of close relationship, but at the same time, they avoid social situation because of the fear of being embarrassed or humiliation, and they also have difficulty in trusting others. So, among the core characteristic of AVPDs are social inhibition, fear of rejection and criticism, feeling of inadequacy. They are hypersensitive to negative evaluation, and also they often avoid any interpersonal interaction. Okay. So usually, client with avoidant personality disorder, they need gradual and therapeutic approach because we need to build trust. We need to build their trust and provide their emotional safety. And it is important to also assess the comorbid condition of the client. And I think it is important also to know how to differentiate avoidant personality disorder with social anxiety. Okay, usually client with personality disorder, when they present in the counseling setting, they will appear tense or anxious. They maybe avoid eye contact with the counselor. They at first usually they will be like hesitant to disclose their feelings, or maybe sometimes they are oversensitive about the feedback given by the counselor because they are fear of being judged by the counselor. So here I present about my case study of S. So S is a single female in her 30s, presented to the counseling session with the main complaint of anxiety and difficulty adjusting to her new occupation. So upon entering her new workplace, S found it very difficult to interact with her colleagues. So even in the workplace, they have like a group chat. So S is feeling anxious to reply, or she often takes a longer time to respond because she has this fear of saying something that maybe embarrass her, or is it appropriate or inappropriate to say this. So usually she will take a longer time to respond. As also avoid going lunch with her colleagues, um, even though she dream of being close to them at the workplace. So, sometimes, as interprets minor social sign such as their facial expression shown by her colleagues as a sign of rejection or dislike towards her. She wanted to fit in with others, but she fear of rejection or dislike from her colleagues. Okay, so now we go to her childhood and family background. S was raised by a single mother, and actually she never met her father, who left her, who left their family since she was born. So her mother often described her father as not being responsible and never put effort to meet S. So her mother, at the same time, also her mother physically and emotionally abused her, even sometimes criticized on her physical body. So as a result, during her childhood, S end up as avoiding the extracurriculum activities in school. So a little bit about her mother. Her mother was a hoarder herself, and the house that they were staying was full of cluttered item and no functional living space. Okay. Um, Sorry, I just go a little bit. So when she in her workplace, S often feel anxious to reply or spending longer time to respond due to her fear of saying something. Okay, sorry. Okay, so so during her visit to the counseling session, and when she met the counselor, she appeared timid and she dressed in a plain way. She speaks softly and she often apologizes before expressing her thoughts. So the main reason that bring her to the counseling session is because she found herself few times crying at her at her workplace without any triggers, and cra- um, she often feeling anxious or procrastinate the task given to her. Okay. Okay, so for the clinical assessment, in the beginning of the counseling session, the counselor should emphasize on assessing the client presenting concern, which is presenting concern, like I mentioned just now, is her persistent anxiety after upon entering her new workplace, and also she always avoid being social with her co-workers, and she got difficulty adjusting at workplace. Okay. um okay Another, the assessment also should focus on assessing her internal interpersonal functioning, on why she avoid the social gathering, and maybe why she feel bad when replying in the group chat, fear of responding in a group chat. So counselor should assess the underlying reason behind this. Okay. uh, Another point to be assessed during the counseling session is her developmental history, where she's being emotionally and physically abused, and so they and also she reported that uh, her her parent style of parenting is full of criticism, and there is also absence of father during her childhood, and that this developmental history might be the reason behind this avoidance behavior and also low self-esteem. Um, it is also important to also assess the cognitive and emotional pattern on why S is feeling inadequacy, about her negative self image that she has about herself. And also, counselor need to assess the comorbid possibility, such as symptom of depression, anxiety disorder, social anxiety symptom, or other personality trait or disorder. And I think it's also important to do the risk assessment because due to chronic stress, S is feeling hopelessness, and there is also emotional dysregulation and social isolation. And maybe it is important to assess whether there is also if there is any suicidal ideation of or any risk of self-harm. Okay. Okay, so for the case formulation based on the 4P biopsychosocial model, for the predisposing factors, predisposing factors, it might be that the emotional and physical abuse during her childhood is causing her avoidance personality disorder. And as mentioned before, that her parents always her parent, especially her mother, always criticize her. And there is also a lack of parental support because her father was absent. So there must be an emotional neglect and also low self-esteem, maybe due to her experience of early development, when her mother is a hoarder, and like her house there is no functional space, so maybe this contribute to the negative self-image and low self-esteem because of the unstable home environment. So this might be the predisposing factor that cause the avoidance personality disorder of S. Okay, for the precipitating factor which trigger her personality disorder is that upon entering a new workplace, it increase her emotional distress because when entering her new workplace, there is a demand of being social with her co-workers. And at the same time, she is having a fear of getting a negative evaluation from her co-workers, and she feel anxious when replying in the group chat, and she often avoid social gathering, and maybe all this invitation for the social gathering trigger her anxiety. Okay. Okay, and then this lead to the emotional distress, and like we see, after she enter the new workplace, she often cries. Okay, moving to the perpetuating factors, her attitude, her behavior of avoid any social interaction is causing the maintenance of this disorder. Okay, and her overthinking and negative interpretation of social cues also lead to this maintenance of this disorder. And another factor that lead to this maintenance is her fear of being criticized or being embarrassed. So by always avoiding the social interaction, it actually give her some, it reinforce means it relief give her some relief, but at the same time it reinforce her anxiety and low confidence. Okay, so this is all that maintain her disorder. Okay, for the protective factors, in this case, like we see that as herself going to seek for counseling and professional help. So this is a good sign because she has insight into her interpersonal difficulty, and she has motivation actually to improve her social relationship. And even though she speak like softly during the counseling session, she's still uh, able to express her emotional feeling. And the good thing is that there is no self-harm behavior or substance abuse reported in the case of this client. Okay, so for the clinical implication of S, so for the counseling setting, as a counselor, it is very important to build a supportive and non-judgmental therapeutic relationship. And I think person-centered therapy is one of the best therapy that can be used to support us. Okay. Um, and also, counselor need to avoid using too much confrontation because this client is very sensitive to criticism. We need to be aware that usually individual with avoiding personality disorder, they are very sensitive to criticism. So it is the best to avoid using, or maybe if we need to use it gently. Okay, another technique that can be used for this case is CBT to challenge his negative thinking, to challenge his maladaptive belief, and maybe to challenge his avoidance pattern. And we can like slowly expose, like gradually expose as maybe giving her some task to like slowly give her to do something uh, to improve her interpersonal confidence, like giving homework for her to test and to give feedback to the counselor after she tests the task. Okay, counselor also should monitor emotional deterioration and social withdrawal. Okay, this is very important to assess whether the condition is getting worse or getting better. And strong therapeutic rapport is very important in this case to maintain engagement in therapy because sometimes person with AVPD, they often um, disengage from the therapy if they feel that like they're being criticized so much. So, but at the same time, if they start to believe the counselor, if she feel that the counselor understand her, listen to her, then this kind of patient usually will have a strong therapeutic alliance, and this is very good for the intervention. Okay, for the referral, I think referral to the clinical psychology is important for further psychological assessment, and also we need to refer to psychiatrist if there is a present of comorbid symptoms such as anxiety, depressive, or trauma-related symptoms. Okay, moving to my second case, which I choose narcissistic personality disorder from cluster B, personality disorder, which is characterized by dramatic, emotional, and unpredictable behavior. Okay, so the common characteristic of those with NPD, narcissistic personality disorder, is that they always exaggerated about themselves. They also often fantasy or have dream of success, power, beauty, or ideal love. And they also feel that they are entitled for special treatment, and they desire to associate themselves with high status individual, and sometimes they feel like only certain people understand them because they are special, and they has this exploitative behavior to get what they want, and also at the same time they also show an arrogant attitude, and they also often envy toward others. Okay, so for the person to be diagnosed as having narcissistic personality disorder, at least they must have all these, at least five of the mentioned characteristic just now. Okay, so in the counseling setting, usually NPD client, they they come to the to see the counselor because of the secondary issue. Usually, client with narcissistic disorder, They are rarely come because of their personality problem, but they usually come because of secondary issues such as marital conflict, occupational problem, or interpersonal difficulty. Usually, client with NPD they has limited insight into their maladaptive personality pattern, and they appear defensive or resistance during counseling. Okay, so here I present my case study of Mr. K. So Mr. K, a 45-year-old Chinese man, presented for a counseling session with his wife. His wife complained of ongoing marital tension within their relationship. Mr. K is working as a senior management position in a corporate setting, and during the counseling session, he described himself as successful, having a successful career in business. So throughout the session, he often emphasized on his achievement, that he often rely on his social skill, his charm to get to the higher position of the corporate ladder. So Mr. K view himself as visionary person, and he described his how office mate as not being par to his level. Okay. So moving to his childhood and early development experience, Mr. K grew up in a deprived household where his achievement was consistently praised. So his self-worth was linked to external validation. His father often praised him as special boy, that he was meant for something great. But when Mr. K uh, reached 12 years old, his father passed away. So what happened next is that he was sent to live in the orphanage, as her mother could not afford to raise him. So despite having experienced loneliness because of being separated from his family, Mr. K coped to cope to do well in his academic achievement, as because he believed that he needed to be successful and superior in order to avoid being viewed as weak, unwanted, or insignificant. So he achieved very well in his study. Okay. So during the counseling session, um, his wife stated that Mr. K often belittled her role as stay-at mother. Okay, sorry. Again, I repeat. Um, during the counseling session, his wife stated that Mr. K often belittled her because of her role as staying at home mother. That Mr. K said that his wife is not doing anything, not contributing anything toward the family. So her wife also shared that K often compare his occupational position with her wife, and this is like ongoing over the time and lead to marital tension. And one important thing that his wife said during the counseling session is that Mr. K recently received a warning letter from his top management due to a complaint from his co-worker because he often belittles them. So since Mr. K received this letter, Mr. K become increasingly irritable, more irritable at home, especially when his wife talk to him or question him anything. Okay, so during the counseling session, Mr. K present to the for the session in a he looked well groomed and dressed appropriately. He managed to answer the question, but sometimes he appeared agitated when his wife said something about him, and actually he just has a minimal verbal response, and his wife answered most of the question. Okay, he became annoyed when his wife commented on his behavior. Um, okay, he said that what most important for him is his career achievement. Other than that, for him, it's not important. Okay. Okay, so for the clinical assessment, it is very important for the counselor to assess the presenting issues, which is the marital conflict and tension between Mr. K and his wife, and also about his occupational difficulty upon receiving the warning letter, and how this affect his emotional. And it is also important for the counselor to assess Mr. K development early developmental experience, meaning his childhood experience, um, how he developed this dependency on the external validation, coping mechanism, and how he developed the coping mechanism under stress. However, it is very important to note that it is very important to avoid direct confrontation, because with it is very important to avoid direct confrontation with the client with NPD, because this may trigger their defensiveness, because as we know that they don't want to look pathetic, they don't want to look weak. So by doing a confrontation, we need to do it like gently and gradually and carefully. And also it is important to assess his empathy level, yeah, and how does he feel when he speak, when he communicate with his wife and his co-workers. And it's important to monitor his reaction toward criticism, rejection, and how does he feel toward his self-image. Okay, another important aspect to assess is comorbidity, whether there is a symptom of anxiety, depression, insomnia, or any stress-related symptoms. Okay, so this is for the clinical assessment. Okay, now we go to the case formulation based on the 4P biopsychosocial model. So for the predisposing factors, um, we can say that the early developmental phase in Mr. K's life and his childhood experience has shaped his narcissistic traits, because his father often said that he is special and he was meant for something great. Okay, so but what happened is that when his father passed away, he experienced emotional neglect. However, he developed a coping mechanism through achievement. So he linked his self-worth with external validation. So this is predisposing factors that lead to the NPD. Okay, for the precipitating factors, okay, what trigger Mr. K is that the warning letter from his top management trigger his emotional distress, because this is like threatened to his self-image and his social status. Um, since after he received the warning letter, it wasn't his marital tension. Okay. Um, the warning letter is a threat to his reputation, and it's trigger his emotional reaction. So this is the precipitating factors. Okay, for the perpetuating factors, I'm sorry for my, because I think I'm tired. For the perpetuating factors, Mr. K What made his condition worse is that he has a poor insight into his maladaptive interpersonal behavior. Okay, so he believed that others are just being oversensitive toward him. Um, and also he has lack of empathy and self-reflection, and this maintain the interpersonal conflict between Mr. K and his wife, and also with his co-workers. Okay, he also often being defensive when he receive a criticism. He think that people trying to pull him down. So this maintain his disorder. Okay. Okay, for the protective factors, um, okay, as we see in this case, Mr. K maintained a stable occupation, functioning and career achievement, meaning he has a stable job here. He also willing to attend counseling, which indicate that there is some hope for the intervention. Uh, and there is no reported of substance abuse of self-harm behavior, and he is able to communicate well. um, and I think the most strong factors in Mr. K case is his wife. He has a supportive wife that are willing to assist him during the treatment process. Okay, so for the implication and referral, okay, as we see in this case, the childhood emotional neglect and excessive praise contribute to narcissistic traits. Um, Mr. K strongly depend on the external validation and admiration of others on his achievement. And what trigger him and cause emotional dysregulation is after receiving the letter, because this he feel this as a threatening to his self-image and social status. Okay. So counselors should understand all this underlying insecurity behind the grandiosity shown by Mr. K. Meaning, we might see this patient as being grandiose, but underlying it is a very fragile and vulnerable um, identity. Okay, so for the counseling focus, the counselor should assess the level of insight, Mr. K level of insight into interpersonal behavior. Should counselor also should explore his defensive reaction to criticism and feedback, assess the impact of narcissistic traits on marital and occupational functioning. Okay, and also it's very, like I said, I think it's very important to assess the possible comorbid symptoms. Okay, I think this is the most important, the counseling goals. As a counselor, it is important to give to increase self-awareness and to give insight into our client about his behavior pattern. So by giving insight, we can help client to understand the impact of his behavior uh, towards others. And also we can help our client to develop a healthier coping mechanism or response toward criticism, reduce defensiveness, and improve emotional regulation. Okay, another goal is to improve the interpersonal communication and empathy to in our NPD client. And also we want to challenge, I mean, gently challenge their maladaptive belief, linking between his self-worth to status and admiration. Okay, for the therapeutic approach and referral, I think for this case, if I'm as a counselor, I'll be using CBT to help him to recognize his distorted belief. And also, I think it is good to use psychodynamic therapy to explore his unconscious mind, and his early life trauma. And it is very important to be empathy towards this kind of patient, but at the same time, we need to maintain our professional boundaries during the counseling. Okay. For the referral, it is important to refer to clinical psychologists for for deeper personality assessment, and also if there is a existing comorbid symptoms, it is important to refer to psychiatrists for severe anxiety for the comorbid symptoms. Okay, for the comparative analysis, the similarity between two cases. One is case of S and another one is Mr. K. The similarity between these two cases is that both client presented with secondary issue rather than personality disorder itself. Meaning both client come to see counselor with issue with their workplace stress, with their relationship conflict and emotional distress. So both client S and Mr. K show limited insight into their maladaptive pattern, and I think this is common among personality disorder patients. They don't realize that they are having this maladaptive behavior pattern. So the similarity between S and Mr. K is that both are having early childhood experience and parenting style that contributed to personality development. Okay, so and both cases also involve interpersonal difficulty that affect their daily functioning. Like S having difficulty to mix around with her friends, and Mr. K is having problem with his wife and also at his workplace. Okay, the differences between these cases is that S with avoidance personality disorder, she appear timid, nervous, and anxious. However, Mr. K, during the counseling session, he appeared arrogant. He appeared defensive and grandiose and always boasting about his achievement. So it's like two different, totally opposite. So for S, she's having low self-esteem and there is a fear of rejection. She also avoids social interaction, sensitive toward criticism because of childhood criticism and emotional abuse. However, Mr. K, he always want admiration and validation from others, and he belittle others and lack of empathy. And during his childhood, what happened is totally opposite from S. Mr. K is being overpraised, and he think that validation increase his self-worth. Okay. So for the counseling approach for S and Mr. K, for S, she need a supportive and non-judgmental environment and unconditional positive regards. Um, Counselor can help to gradually building her confidence level and encourage her to express her emotion. And we can use CBT uh, to for fear, rejection, and avoidance. For Mr. K, narcissistic personality disorder, counselor should have empathy towards him, but however, should maintain a firm professional boundaries. Confrontation can be done, but need to be done gently and appropriately. And our goal is to improve his insight, and accountability on how he behave with people around him. Okay. So last but not least, for the critical reflection, I think a competent counselor should look beyond the presenting issues. Meaning, when client come to us, we should look beyond it, so that we can give early intervention. The earliest the intervention, the better the outcome. So personality dynamic may underlie current difficulty. Early identification improve intervention outcome, And I think it's very important to do multidisciplinary collaboration in this kind of complex cases. And counselors should be aware of her limit, and should refer when they need to do it. Personality related difficulty require, okay, usually personality related personality related difficulty, it require patient and long term intervention. And what is important is strong therapeutic alliance. So this can, by having a strong therapeutic alliance, can give a better outcome to our counseling progress. And it's also important to remember that there is no quick fix for this chronic maladaptive personality pattern. Okay, so that's all from me. Thank you very much.